Think we are live.
So I'm not sure if you're live, but I can read something that says orientation is locked. I would rotate device back again. Let me see. Yeah, maybe we're live. Yeah, so hi friends. Hi there, everyone. So this is online directly from Richardsons Face Hospitals. And so we're trying to get some of the answers to the questions that a lot of our subscribers have been asking us specifically about various facial surgeries. So I would get into some of the particular questions that have been asked prior. I will also answer all concerns that patients have with regards to any of the treatment. So the first thing I'm going to answer is about various, the role of various jaw surgeries for aesthetic improvement. So one of the very common questions many of my patients or many of the people are asking is that, so when you're correcting underbite, why is it that you're not suggesting braces treatments first? So this is something we've got a lot of queries, and a lot of the patients have also had other doctors, other dentists, other orthodontists, other surgeons advise them that they need to get braces first in all cases. So here I would want to give you a short peek about what we're saying, a short view into my concept of these kind of orthodontic or bi-jaw surgeries, or for that matter any jaw surgery. See, when you're doing a jaw surgery, you're not just working on the patient's teeth. The teeth are on the jaws, that's right. You need to use the jaws for chewing, that's right. But you also have the jaws that enable you to breathe. Airway is more important, and so therefore the multiple functions, the movements of the tongue, the ability to chew well, the ability to sleep well without snoring, and the ability to breathe well, all are interlinked very, very finely. And I think this is something that you patients, you people out there must understand. And it's not just putting the teeth from one place to another, or it's not just advancing the jaw or setting it back behind. So what are the various considerations that we have to consider before we embark on a procedure like that? Teeth, yes, of course, but more importantly, the airway, the aspect of breathing and sleeping that is related to the hypopharyngeal airway or the airway behind the lower jaw and the upper jaw. All this plus the aesthetic desires of the patient, the anatomical locations of various nerves, tooth roots, and other issues, these all make us come to the final conclusion. Having said this, we also have softwares, and some of the patients think that everything is done with softwares, but look, it's not the fact. I've had lots of patients asking me queries from the Western world, especially they think that everything is done with software. No, we still have to use these hands, and there's still a lot of skill and experience and expertise that's required. This kind of software planning, computer guidance, everything helps us do it in that much more precision. So that's what I try to tell them, that it's the very big understanding issues here. So I thought I will clarify this first up before we start, because this has been something that my team comes up to me very often on a regular basis, and so I thought that part has to be clear. Having said this, this is just an overview. We have to take each case separately, each case on its own merit, and then make the planning accordingly. All right, so I'm going to look at some of the questions also that's coming up now. I think someone's asking us about the role of steroids with acne treatment. Now, yes, we can take care of a lot of these acne scars, and a lot of it is now actually being handled by our dermatology team. So they are doing a lot of work on laser and so on. And yes, Patricia, I think you're just getting me right. Is genioplasty good for sleep apnea? Absolutely. But remember, sleep apnea is a complex issue where you might have to do surgeries on different parts of the jaws, maybe your soft palate, maybe your septum. And so this is not that genioplasty solves sleep apnea issues. But what you're trying to say here is with genioplasty, many times your breathing improves. So it could be a part of the procedure that we would do to correct sleep apnea. Now, sleep apnea is a very, very vast subject. We do a lot of surgeries. We cure a lot of patients with OSA. And so that is something we'll have to take up separately. So someone asks me the right age for cleft rhinoplasty. So if it's a primary reason, that is if you have a blocked nose, the child is not able to breathe properly in the night, has lots of functional issues, age is no bar. You can get it done anytime. Though at that time we tend to call this as a school-going septorhinoplasty. It's not a definitive one. A definitive aesthetic-based cleft rhinoplasty would be when the child is 15 or 16 years. So yes, you're welcome to come here for hair transplant surgeries. We are available. And with regards to the acne issue, I was just talking before this. So we have an excellent team here. And that's again a lot of our followers ask us. So remember, each and every team member that's here at Richardsons is really better than I am, if not as good as I am. I mean, that's a kind of work ethics we would want to follow. That's the kind of culture that we're trying to imbibe over the past couple of decades. So you can feel comfortable. You can be rest assured that you would get the best quality, best service that's possible. If it is for acne treatment or a sleep apnea correction or for some other lasers or whatever. All right. So with regards to cost of double jaw surgery, typically the cost depends on what procedures we do. And I said double jaw surgery again is a huge umbrella term that just refers to any surgery on the jaws. So please, I request you to send in your specific concerns to our WhatsApp number, which we're going to provide here. And there we will give you the costing for the jaw surgeries. What's the genioplasty surgery cost? So again, we're just getting back to the cost again. Genioplasty roughly is about ₹1.5 lakh, a little bit more, including the stay and everything, depending on the kind of movements we use. And one other thing here, with regards to genioplasty, since a couple of you have already asked me about the same today. So genioplasty, we will be using German titanium implants or plates and screws. They're the best in the business. So the chance that these get infected is very, 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 very minimal. And so you get very good results. So side effects of rhinoplasty, if it's done well and once it heals, I think there's no side effect of rhinoplasty. However, what I face is that some of the patients, even after the improvement is amazing, they feel that they would desire something more. So I don't think that's a side effect exactly, but what you expect out of a rhinoplasty procedure, I think, should be and must be clearly conveyed to the operating rhinoplasty surgeon so that he or she is able to deliver the best possible with him or her, so that you are more satisfied with what eventually turns out. This is, I think, the most important issues, apart from, of course, various medical issues that you have. So if you have a very serious medical issue, then you obviously don't get selected for surgery. So no, we're planning to come live from today onwards, weekly once, God willing, provided we have the time, probably on a Saturday or a Friday. So this is to mainly address questions that a lot of our followers are asking. Either they're asking us on our WhatsApp, asking us on various messages on our YouTube channels or on Instagram page. And it's very hard to explain some of these. So we've done this before. So we're going to do this again till a lot of these questions are addressed. We'll try to address one by one, and so that most of the questions are answered. And well, I think said it like a free consultation, but it's really more about answering your queries. So I have Hamia asking me about what to do with the deviated septum. Now listen, A deviated nasal septum doesn't need you to go for surgery, not at all. Majority of the human population, I think, suffers with that. It doesn't require a surgery. However, if you have a breathing problem, or if you're desiring an improvement in the shape of your nose or seeking a cosmetic nose job, then very often we address the DNS as well. So if there is no breathing problem, if you have no concerns about the shape of your nose, and if on some incidental scans or findings you find that you have a DNS, I think you can let it be. It's not going to cause any problems. I hope that's clear. Um, Sir, is cosmetic treatment done? I'm interested in some Botox and fillers. Absolutely, Geeta. So we have a very extensive cosmetic dermatology team here. We have dermatologists, cosmetologists, and also aesthetician. I'm talking about our branch at Bengaluru, Karnataka. So you could come over here anytime in the morning till about 5 p.m. And all of these fillers and Botox, threads, and all aspects of this kind of cosmetic day care is available, including lasers of all types. So absolutely, for more queries, you can ask us in our WhatsApp number, and so we can answer them. Does your nose droop with age after rhinoplasty, Monisha? So with age, the tip tends to droop. This is a known fact with rhinoplasty or without rhinoplasty. So there will be a very small drooping that happens, which is evident maybe once after every decade, which means it's so subtle you won't notice it maybe for 20 years or something. But yes, as the elasticity of your skin comes down, also the nose tends to um, droop a little bit. Deepak, there is nothing like a starting cost for rhinoplasty, but we can do something like a alar plasty, which is a day care procedure, comes under the large umbrella of rhinoplasty, and that's going to be very little. It's going to be much less compared to a full-blown open structure rhinoplasty with rib graft and so on and so forth. So really, the cost depends on what kind of nose job you need. So if the shape of the nose is not straight, we can absolutely correct that. Some of them do need osteotomy, some may not. Please send us your pictures so we can try and sort that out for you. And Machan, you say that your face is a bit asymmetric. When you say it's a bit asymmetric, I have to find out, or I have to know if it's bony, soft tissue, lower third, middle third, which part of your face. So depending on where the asymmetry lies and how severe that is, you could get it sorted out maybe with a day care procedure, or it could be as extensive as a bony procedure that requires several days of recovery. So please let us know what exactly your concerns are, so that we can give you a much more clearer, better, precise, tailor-made treatment plan. Next is how permanent results we can get for nose surgery. So see, nose surgeries, it takes a while for permanent results. I divide it into three. The initial healing is the time till you can get infected or till the stitches got to be removed. That's about 10 days, the first step or the first primary phase of healing. Then is a type of healing that happens till about the next 20 days, wherein someone else would know you've had a surgery done. That's like a secondary healing, about 25 days, 1 month, and so on. And eventually, there's a tertiary or a third type of healing, wherein you'll start to feel that the nose or the jaws feel, touch everything the same, like how it was before surgery. And that can take several months, 3 months minimum, depending if it's a very small procedure, or up to 9 months if it was a very major, extensive nose job. Yes, Alpha, I do sphincter pharyngoplasty. So pharyngoplasties are procedures that are done to improve the velopharyngeal competence by reducing the amount of space for air to escape, thereby improves your speech. Having said that, you've got to be very careful with these kind of pharyngoplasties, because if it's not done for the right patient, that can cause obstructive sleep apnea. So you're basically correcting yourself on one issue and landing in another. So if it's done on the right person, right patient, yes, it works well. There are other better modalities today to perform than a pharyngoplasty, and that's what I would do most of the times. But yes, to answer your question, do I perform sphincter pharyngoplasty? Absolutely yes. And what's this cost for DNS surgery? So again, DNS surgery, if it's just a septoplasty, it's going to be costing you a fraction of a rhinoplasty cost because that takes less time to upgrade and the recovery is quicker. Stay at the hospital is lesser. And one point also I would want to bring out at this point with regards to costing. See, do remember, costing is a factor of many issues, many things. Now, the way you get costing at Richardsons is a package. They give you not just a surgery cost. That even includes 5 days of stay in your room. Then there's doctor consultation, everything included, medicines and ICU. So it's a package, and so it's different from when you just get an estimate for a surgery alone, right? So that's also something you have to add on to if you were to compare pricing with some other place across India or some other parts of the world. Um, Shakya, do every cleft patient needs jaw surgery? Um, See, I've been in this cleft surgeries for now about 2.5 decades. I've probably performed 20,000 or more surgeries, primary, secondary, tertiary, all types. And to be very honest, a good percentage of kids born with clefts, especially a complete cleft lip, alveolus, and palate, need jaw surgery. Some form of jaw surgery they would need. I would put the rate as 75%, 80%. But if you just are born with a cleft lip, or if it's like you're born with just a cleft palate, um, it's not a very major issue, then you would not need a jaw surgery. So I think that answers you pretty well. So depending on the primary problem or the primary issue the child is born with, you can kind of predict if they would need a jaw surgery in the future or not. Asymmetric face, there are different treatments, like I just mentioned, depending on what your problem is. So I think I cannot just put that in one umbrella. We have to see whether your problem is soft tissue, then we could do facial fat grafting from fillers you could do. If it's bony, you could do various types of osteotomies. Even rhinoplasties can be done to correct asymmetry, if the nose is not in the midline. So these are so many, there are different procedures that you could do to address an asymmetrical face. So Hamia, you're saying something about jaw clicks and you're having a problem with the temporomandibular joint or the lower joint. Now, these again need more investigation. I would recommend you to either come over here in person or get it evaluated by a surgeon who is adept at treating temporomandibular joint issues. Some of them can be managed conservatively, and I think a lot of the younger individuals need to get that done. And in some patients, if the conservative management doesn't work, then we can do other interventional procedures from arthroscopy to an open joint surgery. Most of them do not need that. Again, let me tell you, most of them do not need that. Just for jaw clicking and no paining, you can just do some restriction of mouth opening, and that's just gonna go away in a matter of few weeks or few months. और दांतों में problem है, so yeah, you have problems with your teeth. Absolutely, we have a very state of the art dental setup here. There are about 3 chairs, and they can do everything with digital support software, digital dentistry, how to speak. You can get no impressions taken, dental implants done. There's a very excellent team. We have in-house aligners and the works. So please contact our team if you have queries regarding the same. They'll be more than happy to address you. So Jeffrey, you're saying you have some braces to correct severe open bite, but your face is way too long. So yes, absolutely. Absolutely. We can do all of that. We can reduce the width of your temple bone. We can reduce the malar bone. Everything is possible. Absolutely. So I would recommend, or you should send your pictures with some scans on our WhatsApp number. And we do have online consultations. It's very reasonably priced. You could do that. Of course, direct physical consultation is even more reasonable. That's preferred. So if you're anywhere near the city of Bangalore, which is the India Silicon Valley, you're more than welcome to drop by, and we and our team will help. We'll be more than happy to do what's best for you. So you're in your second year of medicine and you have some issues with your jaw asymmetry. Again, you say you're a body mechanic. I like that term. So yeah, so I just mentioned that if the asymmetry can be sorted out in many ways, please send us your picture with your concern. And sometimes asymmetries are so minimal that you could just probably ignore it or have a beard or something. Let's see. I mean, it just depends on the kind of issues that you're having. So do send in your pictures. No, I can understand very little Telugu, but sorry, I don't speak Telugu. However, I speak all other South Indian languages apart from Telugu. I know Hindi as well. So when you're here, we can talk in one of those regional or other language. I probably can come on live and do it in Hindi as well, but I think English is better because many of these terms are in English and it's more easy for you to understand what I'm saying so that it'll be useful. So yes, adult cleft patients, yes, we can absolutely do bone grafting, no problems whatsoever. This is also a concern or a thing that a lot of our patients ask us. See, remember one thing, age is not a factor. You might be 25 or 45 with 8 prior cleft related or whatever surgeries, but that's not going to cause major issues with regards to our ability to improve. Most of the patients, we're able to improve them so significantly that I tend to use this word cleft conversion. The reason is we want to convert each and every patient with these kind of cleft deformities or cleft related issues into another individual or just like another individual who doesn't have it. So that's what I mean when you say you want to get that kind of work done. So therefore, there's no age bar for that really. Yes, we have some limitations, especially if you've had multiple surgeries, there's a lot of scarring and blah blah. But if that's the case, then we can definitely correct that. We will let you know, okay, I can get you 90% normal nose, 100% good smile, whatever. We try to give you an idea about the amount of improvement that's possible. So yes, you can be frank and ask us with regards to the improvement that you can expect. So there is this question about insurance. So insurance obviously doesn't cover cosmetic treatment anywhere, and this is a simple, easy answer. But if you do a rhinoplasty, wherein you have a breathing issue, that is, we do a septoplasty at the same time, then I think definitely we can get that included under the insurance. That's not a problem whatsoever. So depending on the type of problems, let's say doing a reconstructive surgery on the jaws following a road traffic accident, yes, that's going to get covered. You can get insurance for that. But if you're doing a jaw surgery for cosmetic reasons, and then obviously that is not going to get covered. And our system is very open, very frank, and we're very truthful in the kind of diagnosis we would give. Some patients have been asking us if we can give them a report of an accident when they come for a jaw surgery, and the answer is a big no. So please do not ask us such awkward questions. We will not oblige. We cannot oblige. It's not legal. It's not correct. So only those procedures that can get insurance cover will get them. The best person is not us. Our team will help you, yes, but you can ask your insurance agencies and they will very clearly tell you as to what gets included or what is covered and what isn't. So yes, Mohit, unfortunately, I do not travel to Delhi, so you will not be able to get our services in any other city apart from Bangalore and Nagercoil, which is in Tamil Nadu. So speech improvement, look, there are many surgeries. There are more than 10 surgeries that can be done to improve the speech. We can do from sphincterpharyngoplasties, which you mentioned, most common, modified furloughs, different types of furloughs, single Z plasties, various buccal flaps, otriculture, sphincterpharyngoplasties. We can inject fat in the pharynx. Yeah, so there are multiple things that you could do. Even an anterior maxillary distraction for a patient who has a retruded cleft maxilla, for example, works in improving the speech. So really, you have to come to us. Let us investigate the reason for your poor speech. What is it? Do you need a fistula closure? Or is it that you need an anterior maxillary distraction? Or is it nothing of these? Is something else with your nose? Do you need a septoplasty? So really, this is something that is not as simple. You will have to get that particular patient come over to us, and then we can plan and go about it. So your concern is about taking breath through the nose and the mouth. Yes. So once the surgery is done, you will be able to take normal breathing through your nose. Absolutely. Akash, thank you for following us for the last 3 years. Yeah, I think it's a very, very amazing platform to reach out to a lot of people easily, seamlessly. And so I think help us out so that we can be more useful, more effective to more people. And that's exactly what we would want to do, with that being the mission here at Richardsons Face Hospitals. So Rohit, with regards to internship or any opportunities that we have here, please text us on our WhatsApp number. We do have from time to time, not a lot, because we primarily not a teaching setup. We primarily treating patients. So yes, we do have some observership posts from time to time, but very few indeed. Do nose exercises works? I don't think so, but you can try it, because if you need an elective surgery and you have time, then why not try some of these exercises? But I don't think it works. Doctor, utilize the platform very well to reach these patients. Thank you. You're welcome. All right, so I think the overall message here is that I wanted to start with jaw surgery, which I started also because I thought that is a lot of concerns. A lot of questions I was getting. And Sudhir, thank you. Thank you for following us. And one eye is small due to an accident. So that's because you have enophthalmosis. That's a post-traumatic deformity that can be corrected. You will have to get to us. We might take scans, do what is called as a 3D reconstruction, and we can improve that. Absolutely, yeah. So enophthalmosis, small eye, or whatever imbalance with the eyes, we can improve. If you have improper vision, then we're not able to improve in most cases. But the way it looks, the look of the eye, if it's not symmetrical, we can do that. How long does it take for you to work after jaw surgery, right? So I already mentioned the first phase of healing is 10 days and the second is about 25-30 days. So that's what you would want to keep in mind, 2 to 3 weeks before you get down to proper. With regards to costing alpha, especially speech improvement surgery, please send us more details because as I mentioned, we have to choose the right kind of surgery. And many times we also have to do more investigations. Sometimes we do nasal endoscopy, sometimes we do lateral videoscopy in a cath lab. So all of these things do matter. So, you have to come down and then we can do more investigations and then take it further. तो आपको हीमोफीलिया से दांतों का इलाज करवाना है, तो दांतों का इलाज करवाने के लिए हमारे पास सेंटर है, आप आ सकते हैं और कंसल्टेशन करवा सकते हैं और उसके बाद अगर पॉसिबल है तो उसके लिए आपको ट्रीटमेंट मिलेगी. Hair growth problem from a childhood. So yes, you can get to us for hair growth issues. We have, as I said, a very excellent team of cosmetic dermatologists who would be able to help and guide. I'll also be in the team when they do the hair transplant surgery, but there are so many other procedures that they do, and so that's something that you people can easily take use of and benefit from. All right. I think if you have any more queries, I think I've answered all the queries that is there here. I would want you to I'm ignoring some of the queries related to training and related to some other issues which I don't want to address simply because this is not the platform for that, and the goal of this online video consultation is not to discuss about those things. You can check my website for my complete CV. You can see the channels and you can find out about the extensive work that I've done both in India and abroad and in many, many different places. And so that's something you could do when you have time. We have it all up there for you on social media. You can come directly and go through that as well. So, yeah. So, Shiv Shakti, I was just telling you about this. So, all of that is done. So, cost of rhinoplasty, already told you that it's something you can get to know once you send details. So yes, about the problems with relation to planning jaw surgery. Yes, that's a good question. So when you are planning jaw surgery, we need software or computer help these days. 2.5 decades before, the softwares that are currently in use with us weren't there. So we used to rely on x-rays, we used to scan them out on this white blotting paper, measure the angles. It would take us hours. And yes, and still we need to do that. That was called as cephalometrics. And then based on that, you would think, okay, this is a normal. Where do you take the patient from this normal balance to there? Today, however, things are different. It just takes a few seconds to get all these numbers, angles with the help of the softwares that we have. We have a Sidexi software from Sirona. It's Dentsply Sirona. It's a 3D CBCT machine, and then there's another Nemo software. All these softwares enable us to plan precisely. You can see that we have a state-of-the-art 3D lab here, so we can print out anything, even a ear, nose, a whole face, resins, metals, all kinds of things can be printed out, can be planned, can be designed. So there's a designing unit as well. So therefore, this is absolutely essential. I'm not saying that you shouldn't, you should get surgery, these jaw surgeries without these planning. That's not what I'm saying here. I hope you got me. But also in some of the countries, the Western countries where they have a lot of this, but then still they don't get the result well. I've had many patients who've contacted me and they're like, Doc, what happened? I'm like, see, it can happen, even here, we try to give 100% results to patients, but a few patients are obviously not happy because of the fact that we are not God. We have a very good team with a lot of experience. So once in a while, it happens everywhere, in every great setup, everywhere across the world. That is not because of defective planning, mostly, remember. It's because of the execution or because of a complication that was not expected that shows up or that happens. So therefore, this is the thing with the jaw surgery. So I hope I'm answering that. How to approach you? It's very easy. You can WhatsApp us. Yes, we're busy, but we will get back to you on WhatsApp and we can schedule you an appointment or you can come directly. Micro needling sessions, I'm not exactly sure how many you would need, but our cosmetic dermatologists, they would know exactly. So please come over or ask some specific questions to them. They'll let you know. Hair transplant swelling is 15 days. Oh, so that's not normal. So if it's there in one particular area, maybe there's some infection there, please show your local surgeon quickly. Hi, Nicholas. So once you show that to a local surgeon, they should be able to help you with that. So you have a bump on the nose, you should be able to correct it. Hi from India. Thanks for all your love from Sydney. Don't worry, if you want any more personalized opinion about your nose, then you can send us your queries and we'll be more than happy to answer them, let them know. So complete bilateral cleft lip, you just need one surgery, yeah, to correct the lip and the nose. Thanks. We have someone saying hi from Kashmir. So, the earlier hospital, my first hospital I set up was in Nagercoil, is in Nagercoil even now. And that's very close to Kanyakumari. It's just in Kanyakumari. And we had a lot of patients who used to come all the way from Kashmir, Kashmir se Kanyakumari. So yeah, distance is not a big thing these days. We would be able to treat patients from any part of India, and Bangalore is more centrally located. We are only 25 minutes from the international airport. That's that easy. And Bangalore has one of the craziest traffics in the world, maybe the craziest, honestly. So, with that, with that being said, we're just 25 minutes from the airport. And I'm not saying how many kilometers. So, this part of the city where we are, traffic is still okay. It's not Bangalore like bad. So you can come and approach us very easily. Hi from Nepal, yes. All right, so I think my team's telling me that we need to stop. So if you have any more queries, you can shoot them down to us. You can let us know. We'll be more than happy to answer these queries. I would try to sequence or segmentalize these questions so that the online sessions are more effective rather than clubbing everything together. It becomes a potpourri of different things. So I try to do the jaw surgeries today. I'm going to try and get the sleep on another session, nose and post-traumatic deformities, cleft issues. I get my dermatology team to address some of the issues. So this is going to be an ongoing thing. So do make a note of this. Keep seeing our posts on YouTube. You'll get to know when we are online. So it was nice addressing you. I hope this was useful. And bye bye and take care. That's exactly 30 minutes. I didn't show any.